Nevertheless, in science and medicine, there are standards that are set. There are criteria that are set. Before I go to that, I will want to throw out a question. Why is it that we are against, and I'm one of those against that on principle basis, but on a modified basis, why are we against the testing of vaccines on the African continent, which I state should be done ethically and professionally in a multi-center arrangement? But then we don't apply the same standards to something that was developed right on the continent. I think people need to juggle with their conscience and see where the chip falls. Secondly, there are standards when anything is developed in terms of medication or equipment that it undergoes, certain trials that it undergoes in order to make sure that it is efficient and it is effective and it is safe. The Madagascar innovation, which is their concussion, certainly did not go through those stringent exercises. Up to present, we haven't seen any scientific data from there. We don't necessarily want to see trade secrets, but we would like to see the science behind the innovation. That's simply what the scientific and medical community will want to see. Even if there was any observational studies done, those observational results will have to be produced so that the world look at that. What we look for in any medication is first the safety, and secondly, the efficacy, meaning how effective it is to cure the disease that it is targeted against. None of these we have seen. If you relate it to our situation back in the days whereby we grew herbs and drank them, we only put in our system concentration that we didn't know. Some of these things went on later on to affect our health system, to affect our liver, to affect our kidneys and other body systems in our bodies. And so this is the question that is surrounding this. The WHO is not a policeman. The WHO is a guiding institution. It is not necessarily a regulatory institution. And so it guides how these processes are run. Once it didn't go through that, it will be questioned. My own invention, for example, had to go through rigorous studies. We conducted 3 clinical studies at the United States Food and Drug Administration. We had previously done these diagnostic tests at various institutions where I work. And before it was patented by the United States government, it was also validated. The data had to be validated. Then the 3 studies we did had to be validated as well, or reviewed by independent scientists and medical doctors before they were published. One of those data were published in the International Journal of Infectious Diseases. One was published in Nature, Nature Scientific Report, and the other one was published in Clinical Infectious Diseases. Before that can be acclaimed and accepted. So it's not just producing something and then we take it by a grain of salt and say, yes, it works. I hope that our government would have gathered some of its bright minds who are in the scientific medical areas that have carried out studies before. During the Ebola crisis, as you just stated, we accepted ZMapp to come in as, on a humanitarian basis. But before that, ZMapp was being processed and it was being tested in the process of being tested. And at some point in time in the testing stage, given a particular situation, the regulatory agency gives some sort of leeway for the drug to be used and tried. And that is how ZMapp was sent into Liberia. So that is a different situation, and I hope we don't confuse that. So when you come to the Madagascar, coming back to the Madagascar innovation with this concussion, we have to be very careful. We have institutions, as I said, we have institutions that were put in place. We have people who work on the data safety monitoring board. when we did the Prevail Ebola vaccine trial. I was on that board. Dr. Lisa Cooper, who is presently at the Johns Hopkins University and was appointed at a very high position, was the chair lady of that team. We had two other Africans, one from Sierra Leone and another from Guinea, and then we had other international colleagues. So it was a very stringent board. Then we had the IRB, which is the Institutional Review Board, that reviewed all of the data of the studies that were conducted in Liberia, in I think Spain, and one of the studies was also conducted in the United States. So it was a multi-center study in terms of the Ebola vaccine, which then went over to the Democratic Republic of Congo, where the final studies were done, and today we have an Ebola vaccine. So it's not just an instant invention. It's not just an instant development. It goes through a rigorous process. And that is why in the scientific community, everybody is accepting it, which is good, but taking it very critically.
Is that a last-ditch effort by the government, or it shows desperation if the government will want to try a drug that does not have any medical backing in terms of all what you said? It has not been proven medically to have gone through all of the processes as you mentioned. Does the government stand the risk also of infusing something into its citizens that might be toxic, as you said? And as an expert, what would be your advice to the government on the inducing or giving of this Madagascar concussion to citizens here in Liberia?
I think the government erred in the first instance by not involving its scientific and medical minds. I would be surprised to know if the Ministry of Health and the National Public Health Institute participated in arranging for that formulation. I would be very surprised if they participated in that. They should be the ones to guide the president. The president is not a medical doctor. The president, he had his own career, very excellent sports star, globally known, and performed very excellently, of which we are proud. And those around him in particular disciplines should be the one to guide him. And if they didn't do that, I will not blame the president. I will blame the medical establishment in the country. I don't know if the LMDA, the Liberia Medical and Dental Association, was even consulted on that. If the Liberia Medical and Dental Association was not consulted, then I will blame the Ministry of Health. All of these things should be coordinated. That's what makes a country a country. It is not just people sitting around and making decisions, because these decisions have far-reaching consequences. Now we come to the health situation. The bringing into the country of that concussion was, I think, an error also, because the WHO had advised against that. When I was interviewed on air 3 or 4 days ago on the other network, I also spoke about that and caution. I spoke with very caution. In some instances, I said I was optimistic. I said I was cautiously optimistic that they have some sort of data that we can see later on, that they have some sort of study that they did that we can see later on. Unless we see those things, we cannot just jump to using it and accepting that it's cured. What can the health minister say today as the ingredient of that concoction? Do they know the ingredient of that concoction? Well, probably since they received it recently, they might have looked on the label and they know the ingredient. But has it been tested by anybody, by any other laboratory, even right in Africa? Has anybody done that to see if the ingredients in there are actually the ingredients that we talk about? And the second thing is, how is it that in our system, we will just bring in a drug and the medical doctors who are in the treatment facilities, do they know about that? Did they even sign off on that for it to be brought into the country? I mean, we should respect our institution and respect our professionals. And so that is why I need these institutions and our very hardworking doctors that are in the treatment units and performing their duties on the front line. They should have been consulted. They should have known. And if any of them, if they had or knew, that this drug was coming in and did not put a stop to it, they can also be blamed as misguiding the president. It undermines the efforts of this particular fight against COVID. It sends a signal, and a wrong signal for that matter, that you don't need to do anything. You just take this concussion and then you will be cured. When you compare the usage of that concussion in Madagascar and you compare the non-usage of any concussion in Rwanda, you'll see similar data. Rwanda had 0 deaths with much higher infectious rate. Madagascar, which used that concussion, has 0 deaths with a much lower, I'll look at the data later on. But we are looking at the fact that nobody died in Rwanda, although they didn't take that concussion. Nobody died in Madagascar, although they took that concussion. So how do you compare those two data? If any study was to be done, did they do any control studies in order to say who took the concussion and didn't die, who didn't take the concussion but died, who took the concussion and got healed? These are the 3 major questions that you will ask. How long did it take? What is the dosage that it took? Once all of these things were not established, it is very difficult for the scientific community to accept that. Yes, you can come with the argument that we take Dougbeh back home, quote unquote. It is the same situation. We didn't know the concentration up to today. We don't know the concentration that we put into our systems, but we just took that because it's been done for ages. We are in the modern times now where we have trained professionals. That is why our countries need to focus on developing our capacity. And when we talk about this capacity development, it's not just bringing in a group of people and employ them and you think that capacity is developed. You need quality thinkers. You need critical thinkers in the sciences, in medicine, in the economy, in every aspect of life. So if we had had these, we would have done these studies right on the African continent and validate our own work, and then before going out to the international community. And that is how I see this whole question.
Dr. Nyan, what would have been your advice to the president? Because you just mentioned a lot of issues that they should have passed through. And looking at all of those you mentioned, is the decision more of a political decision to bring this in? Let it be seen as we are doing everything. We want to get our people well, as compared to a scientific or a medical advice.
Before I go to that, I would also think that it presents a very serious situation or an embarrassing situation for the WHO representative in the country and the U.S. Center for Disease representative in the country. I'm not sure, and I can bet my profession on that. I'm not sure they did agree on that. I am sure they advised against that. Now, whether it was done for a political reason or not, it is not for me to decide. We are looking at the medical aspect of it. There are other countries that might have taken the concussion into their countries, and no one would definitely say that they took it because of political reasons. So that is not for me to actually decide. The only thing that I can speak on at the moment will be the medical scientific aspect of why it was allowed in the country and why it should not have been allowed in the country. If I were advising the president, I would advise him against having that formulation in the country to be used for treatment of COVID-19 infected persons. If we wanted to try anything, we should have plunged ourselves into the studies that were going on of the chloroquine and hydroxychloroquine, which have been tried in different countries. We could have set ourselves up as one of the centers for that trial because we have used chloroquine before. So we would have been in a better position to present a case that, hey, support this trial that you are carrying on. We want our center to be one of the multi-center trials. We could have put ourselves in for that. There are vaccines being tried all around the world. And as I stated, these should be tried under internationally acceptable ethical standards. So we could have put in place those standards or make sure that those standards are in place. And we invite that we give people to be tried, in these drug trials. Those are things that I would have advised. But to bring in something that has not been validated, has not been tried anywhere, again, I applaud our colleagues for that because it's innovative what they did. And like I said, probably in the future, there will be data coming out from them. We don't know yet. But unless those things come, you can put that into someone. Our systems are the same as humans, but we react to medications and we react to concussions and formulations differently. That is why when you are given one antibiotic and it's not working with you, we change it to another antibiotic because it may not work with everybody the same way. So we needed to have those data, and I would have advised the president against getting that into the country.
So, Dr. Nyan, COVID-19 has practically brought the world to its knees for, let me say, 5 months now. Can you provide us a global update as to the trend now? Is the situation flattening, or how long should we brace ourselves for this?
Well, we have about 3.5 million deaths, above 3.5 million deaths now. And we have 250,000, we have 3.5 million infected cases.
Yes.
Exactly. Sorry for that mistake. And we have about 250,000 deaths, which takes us to about 7%. Yes, there are efforts going on in various countries, particularly that have these high death rates, like the United States, Britain, Spain. The curve for Italy, has started to flatten since then. And so we are still braving ourselves for a lot more because of the violation of the regulations that have been put in place. They stay in place and lockdown have been lifted in various countries, I think too prematurely, too early. And this may probably in the future cause another spike of this infection because there are the characteristic of this virus is, which is very different from other viruses, particularly Ebola, which we went through, is that it silently infects. And you can be an asymptomatic carrier. You don't have any symptoms, but you are carrying the virus and spreading it out to others. This is the major and main place or main area where we are concerned about. So that is the trend, and that is what we see may happen. It is hope that regulations will be tightened, regulations will be strengthened, and that those countries that are now starting to loosen up will rethink and put in place regulations, even if they loosen up, regulations that will continue to keep the population under some sort of control so that the virus does not spread and then we have a second wave.
Talking about regulations, Dr. Nyan, let's come back to Liberia. For approximately, Friday is definitely going to make it 4 weeks since we had this stay-at-home order issued by the president with emphasis on social distancing and other health protocols that medical practitioners, international best practices are being carried out around the world. How do you rate our own enforcement, our own enforcing